And well, for more on this, we are now being joined by Dr. Arvind Kumar from New Delhi. He is the chairman of Institute of Chest Surgery, Chest Oncosurgery and Lung Transplantation at Medanta, and also founder trustee of Lung Care Foundation. Welcome to WION, Dr. Kumar.
Thank you.
Now, Dr. Kumar, people in India's national capital, New Delhi, they are waking up to a thick layer of smog. Experts are saying that the residents in Delhi are living in a gas chamber. I don't want to sound alarming right now, but the air quality is worsening by the day. It is currently in the very poor category. First up, talk to us about some of the health hazards that the residents in New Delhi are facing at the moment.
So first of all, a very warm good afternoon to your viewers. Thank you very much for inviting me to WION. First of all, I would like to tell that this worsening air quality is not confined only to Delhi. It's Delhi, its entire NCR, and as a matter of fact, its entire North India, which is engulfed by the problem of air pollution. Delhi being capital probably gets attention more, but it's a North India problem. As a matter of fact, it's not as bad, but is bad in other parts of India also. So there is pollution in Mumbai, there is pollution in Kolkata, there is pollution in Chennai, Hyderabad, Bangalore, all the cities. Of course, the levels are much higher in whole of North India, out of which Delhi NCR probably takes the lead. So therefore, it would be wrong to say that pollution is only a Delhi-centric problem. It's actually involving most of the parts of the country. Of course, Delhi being the worst affected. Now, coming to the health effects, the air quality is actually so bad that the effects start from your skin. So there is kind of itching, all kinds of skin problems are occurring, burning eyes, burning in the nose, congested sore throat, difficulty in breathing, even to normal people, worsening of the difficulty in breathing in those who are already known asthmatics, occurrence of breathing problems, worsening of pneumonias in people who have COPD and other problems, known increase in admissions because of pneumonias, because of heart attacks, because of brain attacks. So there is a long list of problems which we all have recorded to occur with a much higher frequency post these most polluted days compared to similar days in rest of the year. So there is a whole lot of health issues. It won't be wrong to say that air pollution is not an environmental or a chemical issue. It is a pure health issue. As a matter of fact, it's a health emergency, if I may use that word.
Right, Dr. Kumar, you do speak of how pollution, which we are witnessing not just in Delhi NCR, but across India, is an health emergency. You specialize in the treatment of surgical diseases of the chest involving the lungs, and you also lead the country's largest and most comprehensive chest surgery. While you have listed out the ailments that people in India are facing because of the worsening air quality, talk to us more about the impact of air pollution on human lungs.
So first thing I notice is that normally the lungs are pink in color. And as a chest surgeon, I get to open 3 to 4 chests every day. And now for the last 15, 20 years, I don't remember seeing any person with the pink lungs as we are born with. As a matter of fact, once in a while, when we get to operate on teenagers also, we see black deposits on their lung. It's a rarity for us to see normal pink lungs in people. Earlier, we used to have a differentiation between city dwellers and those coming from rural areas. But in the last 15, 20 years, I think even that difference has disappeared because there is as much pollution in those areas as is there in the city. The sources may vary, but ambient air pollution here and household and other causes there, overall effect is the same. So I'm seeing a worsening of the blackening of the lung. And the other impact which I have seen, which is a very grotesque kind of figure, is a change in the demography of lung cancer. So I specialize in lung cancer treatment. When I look at my 30 years career, 30 years back, most of my lung cancer patients, 95% plus, were known smokers. One, they were in 50s and 60s mostly. Very few women, and this was the overall scenario. These days, number one, we are seeing more. So every OPD, when I sit today and I look at the lung cancer as a percentage of my total patients, it's much higher today than it was 30 years back. So we are seeing more lung cancer. Number two, the difference between smoker and non-smoker is gone. 50-50 is the current distribution. So a so-called smoker and a so-called non-smoker, according to my data, and it is also corroborated by other cancer centers, it's an equal distribution, which is a very, very alarming change in a short span of 30 years that I've seen. And I attribute it to air pollution, because 22 micrograms of PM 2.5 is equal to one cigarette in terms of lung damage. So if your PM 2.5 today is say 400, it's almost equal to smoking 20 cigarettes. So in true sense, in a polluted cities, there is no true non-smoker. Everybody is a smoker. And that is the reason why I'm seeing 40% of the patients to be women, so-called non-smokers from non-smoking families. And the last but very alarming change is a decline in the age group. So today, 40s is my peak age group. 10% of the patients are in 30s. Right. So effectively, we are seeing more cancer, more in non-smokers, younger age, and also in women. So it's a very frightening scenario which is evolving primarily due to exposure to air pollution.
Right, Dr. Kumar, I would just to add to what you said, that inhaling toxic air in Delhi or anywhere else is equal to smoking at least 10 cigarettes a day. And that's why you've clearly mentioned that the segregation, the bifurcation between a smoker and a non-smoker has clearly been eliminated due to air pollution. While we have spoken about the concerns of air pollution and how it is an alarming situation that all of us are seeing today, what, according to you, are the best precautions that one should take in a bid to protect themselves from the air quality that we are witnessing?
Before answering that question, I would make an appeal that before thinking of protecting yourself, each one of us should be working on how do we prevent this kind of air pollution. Because truly, if you are breathing with air quality index being 400 plus, let me tell you, there's nothing in the world which is going to protect you. All the measures that we have, masks, purifiers, staying indoors, etc., fail if you have air quality of 400 plus. So I think there is an urgent need for a movement of people at the national level where everyone should think of two things: reduce the dust and reduce the smoke. You know, everybody keeps blaming government or things like that. I always say pollution is not caused by government. Pollution is caused by the activities of 140 crore people of the country. And if each one of us starts spending some time to reduce the amount of dust we are putting out into the environment and to reduce the amount of smoke we are putting out, together it will become a substantial issue. So my humble appeal, first, we should be talking seriously of preventing this kind of AQI. Now, having said that, at present we are faced with what it is. So what when we do? Number one, avoid going out at times when it's worse than other time. For example, early morning is the worst time because during the course of the night, all the pollutants, they settle. And that is why it's most toxic for children, because they are at a height at which maximum pollutants are there. And early morning, they go to schools, they run, so they have exposure to higher levels. So people who go out and exercise in the gardens and all should not do so. You should do whatever you want indoors. Number one. Number two, every time you go out of your house, you should have an N95 mask. The cloth mask, surgical mask is no good. N95 should be worn, and your nose and mouth should be covered, and it should be properly fitting so that all the air passes through N95. Those who are known chest disease patient, for example, asthmatic, COPD patient, should take their medicines regularly, and if needed, increase the dosages in consultation with the doctors. Keep yourself well hydrated. Liquid intake is necessary, and it is said that intake of antioxidants, and antioxidants are present in high amount in colored vegetables, that kind of helps in the reparative process in the body, so that can help. Adequate diet, neither overnutrition nor undernutrition. So these are some of the measures that we can take, protect us. But I would go back to saying that prevention of this level of air pollution is the answer. Once you reach this level, no technique or technology in the world can protect you.
Right, Dr. Kumar, thank you so much for joining us in WION and giving our viewers an outline and a guideline of the kind of precautions that they should be taking as the air quality worsens. And as of now, the air quality in India at 8 a.m. in New Delhi at 8 a.m. local time was at 361. But thank you for joining us on WION.